Okay. Hey, everybody, this is David Paul, the host of the Capital Stack podcast, where we talk to founders, operators, and investors about all thing value creation within startups. Today, I am talking to Spencer Hutchins, who is the founder and CEO of Concert Health, which is a collaborative care management platform for primary care. Spencer, how you doing, man?
I'm doing great. Thanks so much for having me.
Tell me, Spencer, what is Concert Health? Tell me the Concert Health story.
Yeah,
Make it
well, what we're
really
trying to
interesting. Really interesting. Like blow me away.
sounds good. Well,
Use voices.
we're trying to build the country's best behavioral health medical group. So we are incredibly fortunate about employing better than 250 behavioral health clinicians, psychiatrists, and psychiatric nurse practitioners. We're delivering care in 13 states right now. What is a little different approach is that we're focused intensely on integrating behavioral health services into the primary care provider that we all trust most. Right? So we treat people not separately, but in direct connection with their primary care provider using a model called collaborative care, which is an evidence-based way to sort of both screen for, diagnose, and treat a host of behavioral health symptoms in the primary care setting. And so basically, if you uh, have a concert enabled primary care team, right? If they're working with us, and we work with about 65 medical groups and health systems across the country now, have cared for about 40,000 patients. And instead of, what happens now is probably half the time, if you have depression, you don't even bring it up. You don't realize it yourself, or you kind of hide it a little bit, right? Fortunately, that's getting better, right? There's more and more awareness and willingness to seek care, but still a lot of people that are maybe resistant, either because they don't realize it or resistant to the idea. But maybe if you do bring it up to your primary care doctor, you do it 8 minutes into a 7 minute visit, right? And then you end up with a really unsatisfactory answer for everybody, which is they shove a medication into your hand, tell you to go see a therapist, and run to their next appointment, right? And you're not really sure if you want to take the med or what it means or whether or not, and even if you try to find a therapist, it's really hard to find one in your network. If they work with Concert, they say, hey, I'm going to have a colleague of mine at a group called Concert Health call you today or tomorrow, and they'll touch base with you in between my visits, see how things are going, track your symptoms, and teach you some coping strategies that a lot of my patients find really valuable. And they will let me know what's going on. So we'll actually have a shared plan, make sure we're really supporting you. And I can do a much better job as your doctor if I work alongside this other professional. And it would be all right if I have them give you a ring. And so from a patient, a lot more integrated. You finally actually have providers that know what the heck each other's doing, right? And so you actually have a shared plan, a shared understanding of what's happening. And then our psychiatrists get to work in the background to really support primary care as they make those decisions about diagnosis, medication, all of that stuff. So they feel like a hero, they feel confident, and they do a great job managing a host of symptoms without needing a referral and identifying really serious issues and hopefully getting you to the right side of care for the minority of time you're going to need more than primary care.
And how does the billing work?
Well, this model called collaborative care has been building an evidence base for 20 years that showed not only does it provide great results, it provides much better results than primary care. It can act on its own. Frankly, almost certainly provides better results than behavioral health clinicians often prescribe on their own, right? This combination. And also for years, it's shown that it pays for itself, that by doing this early intervention, you end up saving health system expense later on, right? Some of it through escalating behavioral health expense, more medications, higher level of intensive outpatient programs or psychiatry visits, but a lot of it on the medical side, right? Avoiding your pre-diabetes becoming type 2, things like that. The reason we started Concert, and I had the really great fortune of starting it with an amazing and inspiring clinician, Verna Little, who's a psychologist, a social worker. She's one of the people that was really around, right around its birth of this model and has been part of shaping it. The reason we started Concert was because in 2017, it became a Medicare benefit. And after 2017, Almost every commercial health plan followed. And now Medicaid, Wisconsin just snuck up on us and added it to the Medicaid fee schedule as state number 21. So it's really, really broad insurance coverage. And so basically what Concert does is work as the easy button for groups that say, this sounds great, let's do, but I'm not sure I know how to do it on my own. And so we essentially build the service line alongside primary care and find a way that both teams are paid properly for the great care we do together.
That's amazing. So 20 years of research. I mean, obviously, if a therapist and a doctor collaborate, the outcome's going to be better. I mean, that goes without saying, but easier said than done. However, the business model wasn't there until 2017 when it actually became reimbursable.
Yeah, I'd say there's a couple of, one is I'd say actually, just the co-location doesn't do a whole lot, right? So you put a therapist in a physician's office. It's great. It's more convenient. They're working down the hall. They might know each other. But in reality, it doesn't really change the way the two practices work. The therapist fills up. They're doing their normal schedule. They've got a 4-month wait. They just happen to work down the hall and nothing, it doesn't actually change it that much. The two things that really dramatically change it is one, the jargon we use in healthcare is called treat to target or measurement-based care. So one really important part is that we don't take our benefit for granted. We actually use a tool with patients every month to actually assess quantitatively their symptoms. So most commonly for depression, there's this little survey you get called the PHQ-9. Probably most of your listeners have gotten it at least one time when they go to the doctor's office that sort of says, hey, in the last 2 weeks, how often have you had these various set of symptoms? Use that not only to screen at the front end, but use it over time. That really helps everyone stay accountable, the patient, the behavioral health clinician, the primary care doctor, on who's not getting better, or who's getting worse, and how do we change up the treatment if they are. And the second point is the psychiatric consultation. So for folks that aren't getting better, for folks that have really bad symptoms, to do this weekly review in which the psychiatric provider works with the therapist and the PCP to say, okay, what are we going to change here? New form of therapy, new approach, new diagnosis, new med, new dose. And it's that sort of rigor around measuring, improving, testing, and learning, kind of an engineering mindset to behavioral health symptoms that really drives the value.
So 2 things that came to mind. One, when you said Medicare covered it, was it a Part B benefit?
Yeah, it's a physician service, right? And so it's one thing that's really powerful is that sometimes healthcare, we just made this terrible decision a couple of generations ago to pretend that the mental health care system was separate from the rest of healthcare. We called that's behavioral health. That's something different. We have a different set of health plans, different set of coverage. It's an original sin, right? Because now every primary care doctor will tell you, every person that struggled or seen someone in their family, it's intermingled, right? The idea that your depression is separate from your obesity, which is turning into pre-diabetes, which is turning into type 2, those things feed on each other. And you've got to manage it together. A nice thing that Medicare set the precedent for, and now almost every commercial health plan in the country and the majority of Medicaid beneficiaries now have it, and it's part of the medical benefit. It's part of your medical primary care benefit, which means you can get a primary care copay. You don't need to deal with those behavioral health carve-outs. It's part of your core insurance. Got
it. And so, from a business model perspective, and this is what I was, how I would think about it. I mean, you're a tech-enabled service company, meaning there's humans that have to deliver value. And I think about on the demand side, how were you able to balance, recruiting the patients and making sure that the doctor's engaged, in a way that was meaningful and repeatable? Because, I know these doctors just as well as anybody. I mean, they're so scatterbrained, everyone's busy, so how did you keep Concert top of mind?
I mean, it's a constant challenge, and 1,000 things we've learned over the last 5 years, which are part of the core success and IP of the organization in terms of the sort of go-to-market, muscle. I'd say first and foremost, our view's been you got to have a lot of empathy for the primary care doctor and deeply understand their situation, which is they feel undertrained. right? They got a couple of shifts back in med school. They used to have drug reps come along and talk to them about stuff. And then every day they're seeing depression and anxiety, alcohol abuse, substance abuse, and they're wishing they could send it to referrals, but there's like nobody that takes insurance, right? And even, now increasingly more people would like to engage in, especially, if you could find them a therapist or a psychiatrist, they'd go. But you can't find them. And there's still a lot of people, particularly older adults, particularly folks from different ethnicities, different lived backgrounds, maybe less likely to engage. And so the PCP's left on their own, feeling like their counselor or psychiatrist all wrapped in one. And, oh, by the way, you got to do it in 7 minutes, right? Because your business model as a primary care doctor doesn't work unless you see 25 patients today or 30 patients today. And so we try to deeply understand and appreciate that, right? And really work to sort of say, listen, let's make it easy for these people to identify. Let's really have them trust Concert Health by dedicating a team, really getting to know their practice patterns, and then save them a little time and stress every day, right? So they can sort of say, hey, I'm going to have someone from Concert reach out to you. I can get to my next appointment, right? Really sort of respect and appreciate that, and then be there for them on the tough patients, on the things they're not sure of, right? On the diagnosis decisions and others, and be ready to support them, make them feel like superheroes, make them feel like they connect better. And ultimately, for years, they've been on treadmills, right? Primary care, we ask them to do everything, and then we pay them barely at all, right? Or we only pay them based on, per visit, right? So everything's about see more throughput, more throughput, more throughput. And what we can be a small difference on is, hey, you don't need to see more patients. You can deliver more comprehensive services to those patients, right? By really saying the definition of primary care in the future is going to include a much more robust behavioral health intervention than you've been able to do before. And by really focusing on that, they get excited about it, right? Because this is nobody got into primary care so they could see 30 people a day and barely remember their name. No one got into primary care so they could be just a referral spigot, right? They got in there because they wanted to help be that partner, right? That person that really understands the patient, gets to know them, and can make a lot of decisions themselves and help them navigate through the health system. And I think by being that partner, having empathy for what has gone wrong in the U.S. healthcare system in the future, and being at least a small part of making it a little bit better alongside them really goes a long way.
And so there has to be an event. A visit needs to occur in which the doctor gives them this test, which I forgot. You just talked to it. Yeah. And then they say, okay, you qualify for this. I'm going to refer over to Concert. Is that correct?
Yeah, I mean, a lot of it is still can be clinical judgment, right? They can, doctors are doing this every day, right? When they go into that exam room, they sort of assess anxiety and depression, things like that, either because the patient self-reports it or because they can pick it up. That's their experts, and we never get in the way of that clinical judgment. But we layer on top of that to say, listen, when you do that, the public health statistics say we probably pick up a little less than half, right? Of the issues. Because if you think about that, if you're getting to go into your doctor, right, that you kind of get revved up. You get ready to go. No, I'm doing fine. Oh, it's not that bad, right? I'll be okay, right? And that's where those tools, like the one I mentioned, the PHQ-9, have been pushed and commonly suggested, right, and often encouraged to do on a universal level, right? And so a lot of times, American Academy of Family Practice, Medicare, ACOG, the OBGYN groups, are sort of suggesting, have for years, the recommendation's been everyone should get that at least annually, right? Because you're going to pick up a lot of people that are suffering and you don't realize. And then you should also get it around other events, each trimester of your pregnancy, or after a major medical diagnosis, after hospitalization, because at each of those moments, both the risks of and the consequences of uncontrolled depression or anxiety are even higher. One thing we've also been pushing, been in the news a lot, is suicidality, right? And making sure people understand that you should ask around whether or not people have had thoughts of suicide. It's really important because such a high percentage of people have seen their primary care doctor within 60, 90 days before death by suicide, and how powerful that can be as a tool to literally save lives.
Wow, absolutely. Yeah, no, that's huge. So I think about like a similar business model like chronic care management, right? Where there's a revenue share. I don't know if you can call it a revenue share, but a split of fees and billing. from a contractor basis. And I would think that their business model would be a little bit easier because their population is people with chronic care conditions, meaning 2 or more conditions that last over a year. And like they literally just need to plug into said EMR and find those patients if they've got the doctor's permission, of course, and then do outreach to them. Whereas these targets are, not in the EHR, they would have to be kind of like a live. Am I thinking about that correctly?
No, they could be both. I mean, for sure. You go and we do this all the time working with our medical group partners. They all have, some meaningful percentage of their patients that are already diagnosed with depression or anxiety. You can use the diagnosis codes, right?
Got it.
Or you can use the medication stream, right? So you could see, okay, who got Prozac or who's on Lexapro,
Smart.
who's on, those sort of things. And so similar tie-ins as you build the comfort. I'd say that there's a little bit more upfront training, coaching, support from us because it's a more in-depth clinical intervention than maybe a remote patient monitoring or a chronic care management, which is sort of just a check-in. And so there's a level of deeper probably provider training, to get comfortable doing it. But then I think there's all those, population health measures that you can build to help make sure you get your arms around everybody that's in need.
Yeah, because your goal is to not interfere with the practice's workflow. You want to give them less work, not more work.
That's right. Yeah, I think, we focus a lot on that, which is never overpromise, but if we're doing our job right, we should be making each one of their days a little bit easier, saving them a little time and a little stress, right? Because they can have a triage point, right, that they have a high confidence in so that they can move through their day, they can connect. And then also, frankly, patients with uncontrolled depression or anxiety, they hurt the operations of the practice in a lot of ways, right? They're more likely to cancel their appointments or come in way too much, right? They're more likely to extend the visits, right? All of those sort of things. They sort of muck up the general operations if you don't feel like there's a path, right, of how can I really support this person, get them what they need, and do it. And then also, we hear this over and over every time we talk to doctors is it's those patients that are some of the most likely that they feel they think about that night, right? Oh my God, Spencer, I see him getting more and more desolate, right? He's losing energy. I see and I don't feel like I'm helping. I put him on that, SSRI, but I'm not sure it's the right one. He refuses to go see a therapist, so those are the ones they're thinking about on their commute home. They're thinking about their kids' soccer practice, as they're living their life. And the more support we give them to say, listen, I know I have a clinical partner that's an expert in this, that's got them, that's making sure people don't slip through the cracks, that can be a really powerful way to build and extend a partnership.
So what's next for Concert? I mean, there's so much TAM available, right? So, I mean, are you feeling like this is just an opportunity to continue to educate and further pass this model on? So it's more going wide than going deep? How do you think about the next couple of years for you?
Yeah, I mean, I'm just, humbled every day of the opportunity we get. We're now working with some of the biggest health systems in the country. We have thousands of primary care, pediatrician, and OBGYNs in our backlog, that are signed and we're now looking to launch. And so a lot of it is clinical and operational excellence. How do we create that? How do we hire amazing folks? And then build an organization that cherishes and respects their work so that they can be the best behavioral health workforce in the country. And so a lot of it is on that, just excellence, sustainability, scalability, as we do that. Ultimately, we also are on a journey already with some of the most progressive primary care groups in the country that are shifting their model away from getting paid per visit, to getting paid to keep a population healthy. The jargon, we always like to use jargon here in healthcare, so we call it value-based care. And I think we can do a lot to embed in that, make them more and more successful, and make sure our business model sort of morphs alongside them as we both take more and more accountability for outcomes and more accountability for total population health. I also think that ultimately we're doing this in pockets now, and I think there's just so much opportunity as we continue to scale, as our tens of thousands of patients becomes hundreds of thousands of patients we're supporting. We can be a really powerful site of navigation. There's so much innovation in mental health right now. from long-standing organizations in the community, from a new breed of startup organizations that are scaling, that are doing individual conditions, certain severe and persistent mental illness things. And I think we have an opportunity to really help identify the highest quality folks, and then find a way to navigate patients to the right place. And I think that's a really powerful place for us to play in the ecosystem long term as well, to be that general contractor sitting alongside primary care.
Yeah, so customer discovery must be very, very important in your business, because there's probably a really large upfront cost that you have to lay out in order to get set up with Concert, right? Because I'm sure they're not paying you setup fees, right? These docs, they gotta, they're getting paid on a variable rate on their fee for service, and you need to set up the infrastructure, the training, the integrations, and all of that. So you really want to make sure you nail the right customer.
Yeah, I think that's right. And as we've moved up market, now working with some health systems, we've been public about Advent Health, based in Florida, but in 9 markets. Common Spirit, we're working with across many markets. Trinity, starting in New England. We've been fortunate. Those certainly take some time to do, but I think we have been really looking for, one of our core values at Concert is trust. And we try to be trusting of our team, right, and give people objectives, and let them flourish, right, and trust they're going to find their way to it, and also really look for trustworthy partners, right, and that's, I think, people that want to create a genuine win-win relationship and have that be centered on winning commercially, operationally, through excellence in patient care, and finding those things. So I think we are getting better and better, and I think we're proud of, frankly, jettisoning a fair amount of groups from the sales pipeline if we're not getting the feeling that, hey, they're in it to win it together, that this is going to be win-win, not a adversarial relationship, and that it's going to be focused on winning through excellence in care.
That's great. If I have a lot of problems, can I call you just directly?
We don't do a lot of direct to consumer work. I mean, there's some great organizations that are trying to do that, right? We've taken some and things, but I think our real belief is, I'm glad there's direct to consumer organizations out there. Some of them are doing great work. I'm glad there's direct to employer, conversations in which they're trying to get these as an employee benefit. But we think of both of those as building a better silo, right? Which is creating great experiences, good quality, but still thinking about behavioral health as a standalone thing. For some people, that's the right thing. That might be all that they're struggling with, and they really just need to connect. But, our belief and what our, value is that integration with the doctor they trust most is going to help unlock both clinical outcomes and access in a way that nothing else will. So that's really our sole focus.
Yeah, that's really good information, but I'm still going to call you if I have problems.
Yeah.
I've got your cell phone number. I don't want to do a lot of other work. I'm just going to call you.
Yeah. It is. I mean, one thing I'm always, for those of us that have been business stooges in the U.S. healthcare space, it is, you have to really respect that of just what is different to be a clinician, right? Because, I see that all the time, right? You've got to flip that, whether it's our medical leadership, our behavioral health leadership, right? People always do that. And then you got to flip it and go, oh, I actually I need to help you right now. I need to support you. And you realize that, if you choose that calling, if you're a social worker, a nurse practitioner, psychiatrist, that it's not just the job, it's something you have to do. And we got a lot of them on this team. So definitely don't call me, but we've got some great people here that can do better.
Awesome. Spencer, thank you so much for coming in. I really appreciate it. A couple canned questions. What is your favorite book?
I was just reading this kind of recently. I've been loving it. I live in California, moved here 12 years ago. I've just been fascinated by how badly we have messed up housing policy in this state, haven't built enough of them, and why it's so darn expensive. And so The Life and Death of American Cities by Jane Jacobs, she wrote it back in the 70s, but I just think it's sort of, you read that and it all makes sense. And it's a little depressing because it was the beginning of my life. She wrote that, and we're still messing some of the things up she figured out way back then.
What was the best piece of business advice you've ever given or ever gotten?
I'd say in my recent journey, a few folks that I did a company before Concert. We had some success. I was involved, and I think there's a little bit of there was a tendency in healthcare in particular to say, oh, if you think you want to go raise venture capital, it has to be a software business, right? Because that's what VCs want to invest in, software scales. And I think I had a few mentors that said, and helped me get to the point that said, listen, just go solve the problem the way it needs to be solved, right? And then, yeah, you got to make sure, is there a business there? Or don't use a startup as the vehicle to make that difference. And really understanding that, we use the jargon now, tech-enabled service, to mean, hey, it's not just the app, it's the app and the great clinicians. I think it was a profound piece of advice a few people got me towards, and recognized, like, don't fit it into a financially motivated spectrum, or help someone else pattern recognize from things they like to do, but focus on, what is it that takes it to solve the problem. I think that's what helped us realize that Concert was, yes, going to have great software, yes, going to have great engineers and designers, but it really also needed to be inclusive of just amazing clinicians that helped get the real work done.
What's the coolest, besides Concert, what's the coolest healthcare company that you like to follow? Oak Street?
I can't pick favorites. Oak Street is a company that I've been inspired by from the beginning. One of my board members, Edward Bergmark, was the first outside investment there that moved. Here in town, I always love calling out Equip Health. They're an amazing group of founders. We've been on the journey about the same time. They're in a virtual eating disorder provider that I think is just doing really inspiring work, and have loved following Christina and Aaron, that founding team, and grabbing drinks every once in a while and sharing notes, because I've just been inspired by them, and love the fact that it's an example of really San Diego being the epicenter of health tech.
You're going to pump your book? What about WellBe Health?
Yeah, WellBe's a great company, early stage. I've been advising them and doing amazing stuff in chronic care management and remote patient monitoring. Love them. Seth and Ty and the team there are doing great work.
There was a great article, it was a Crunchbase article today about RPM. It was pretty interesting. But anyway, yeah, no. And anyway, thanks for coming in, everybody. We are dropping an episode every Tuesday on all your favorite platforms: Apple, Spotify, and YouTube. If you like it, please subscribe, leave a comment, share with your friends. See you next week. Bye-bye.